And in tonight's edition of 7 Up Front, we're talking to a Beaumont doctor about the FDA granting full approval to Pfizer's COVID-19 vaccine. Experts say the move is a game changer. Right now, more than 80 million eligible Americans are still unvaccinated. 31% of those who haven't gotten the shot say they would get it if it were FDA approved. Meantime, daily average cases are up 230% in the U.S. in the last month alone. The president now urging the unvaccinated to get their shots as soon as possible.
Those who've been waiting for full approval should go get your shot now. The vaccination is free, it's easy.
As concerns grow over the Delta variant, Warren Consolidated Schools is the largest and latest district to make indoor masking mandatory for students and staff. Detroit and Ann Arbor public schools are also requiring face coverings. Right now, Dr. Matthew Sims, Director of Infectious Disease Research at Beaumont Health, is joining us live. Dr. Sims, we appreciate you being here with us tonight.
Happy to be here.
So with this big news, does Michigan now have a shot at reaching that 70% herd immunity goal?
You know, I'm hoping we do. You know, like you said, about 30% of the people who haven't gotten vaccinated yet have said that once it's approved, they'll get vaccinated. And they've been waiting for the FDA to give their final blessing, so to speak. It's here now. So now we'll see how many of those 30% move forward, hopefully all of them. If we can get that, then I think we have a real shot. And, you know, every bit helps by protecting more people and preventing more spread.
Well, if FDA approval of the shot doesn't do it, you know, and the shot to win sweepstakes doesn't do it, you know, what are we going to do to convince people to get vaccinated? What will it take, do you think, doctor? And how big of a risk do unvaccinated people pose with school right around the corner?
Yeah, as far as what it'll take to get people vaccinated, it's hard to say. Some people will just never get vaccinated no matter what. They don't believe in it. They think it's dangerous, despite the fact that all the studies say that it's safe and effective. That being said, there's a few things that help convince people to get it. Their own doctor telling them what they think, that if they feel that it's the right thing to do, has been shown to help tremendously, because that's somebody they have a relationship with and they hopefully trust. Their families asking them to get vaccinated so that they can be protected, so that they won't lose them to COVID. That's been shown to help. So there are a number of things that you know really speak to people. That being said, you know, again, the hope is to get over 70%, and the closer we get to 100, the better, because the smaller the number of unvaccinated people, the less chance of spread, the less variants. And you mentioned schools coming up. You know, I'm glad to see more and more schools following the CDC's advice and mandating masking for everybody. I think that's the safest thing to do. Masking is safe. There's you know, people have talked about higher levels of carbon dioxide or more chance of, you know, infection, things like that. But, you know, surgeons have been wearing masks for, you know, their entire careers, sometimes 10, 12 hours a day, sometimes more, you know, and, you know, we haven't seen anything related to that anywhere. So the whole idea that masking is dangerous is kind of, you know, unfounded. And, you know, it has been shown, including by a study that we ran, that they work.
Yeah, well, that is an interesting point, Dr. Sims. We certainly appreciate your insight, and we'll just have to wait and see what happens in terms of protection, and especially as the school year gets ready to take place.
Yep.
We'll be talking again soon. Thank you, Dr. Sims, for joining us.